I would like to introduce not Mr. Dan Siegel or Dr. Dan Siegel, but muy Dan Siegel, the most flexible, adaptive, coherent, energized, and stable person I know.
But what we're going to do is talk about the mind. So let's begin with the question, how many of you would say that you have a mind? Let's start with that. So raise your hand. Okay, great. So that's most people. Excellent. Now maybe some of you are not raising your hand because, as you probably know, that word actually doesn't have a shared definition, and in fact it usually doesn't have any definition. So that's probably very appropriate to say, why would I raise my hand and say I have one when I don't know what it is? Where is your mind? What is the connection between the mind and your body? There's something happening in the betweenness between this body and the body you're sitting in, right? So that's an interesting thing, just to start out with the where, just to stick with the where for a moment, that there's a betweenness to it. But how many of you would say, whatever this mind thing is, which we'll get to next perhaps, that it's also inside you? Anybody would feel your mind is also inside you? Raise your hand if you would say that's true. Let's just see. Okay, so we have this weird thing we've just come up with, that the mind, whatever it is, seems to be both between, like happening between us right now, and within. Well, that's interesting, or some people might say that's really bizarre, but we're saying there's one thing that might be in these two places all at once. So then the question is, what is the mind? Now let's just start with some of the data. The word mind, M-I-N-D, is a very interesting word, and its definition in the field of, let's say, where I come from, I'm a psychiatrist. In the field of psychiatry, there actually is no definition of the mind. There is no definition of the mind in psychology or psychiatry or anthropology. And here's the most amazing thing. In the philosophy of mind, you are not supposed to define the mind. I'm not kidding. I have dear friends who are philosophers of mind, including this new friend we just made. And if you say to them, well, you just wrote a book with mind in the title, but you don't define it, they go, of course not. Well, please explain that. Because once you define it with words, you limit your understanding. So then I said, well, why do you have a word for mind? And they go, because it's a placeholder for the unknown. So this is what I say to, whether it's research psychologists or psychiatrists or philosophers who say this. I said that makes total sense. Makes total sense. You know, psyche, which is, you know, in the Webster's dictionary is defined as the soul, the spirit, the intellect, and the mind. Those are synonyms for psyche. So a psychiatrist is a caretaker of the soul and the mind. So I said, well, look, if I go to a person who's coming to me for psychotherapy, right, what would that be a therapy of? Therapy of the mind, of the soul, right? And my patient, as psychiatrists we call people patients, you can call them clients. You know, in our interpersonal neurobiology study group, we decided we'll drop those two terms and call them fellow travelers, because that's probably more accurate. So if a fellow traveler comes and you're joining them on the journey of life, trying to help them find more well-being and less suffering, and they say to you, well, you're my mind therapist, right? And you go, yeah. And then they say, well, what is my mind? And you say, it's a placeholder for the unknown. Why would they continue seeing you? Right? So this is really a problem. It's a problem because, first of all, how many of you feel like if you eat something really weird and it affects your stomach, or now we know if something affects the bacteria in your intestines, that it will affect your feelings, thoughts, and behavior? Anyone know that? Yeah. So why is the body being left out as the source of mind? That's just a weird scientific error. And the second thing is, how many of you have had the experience where your relationship with people close to you, whether it's friends or family or neighbors or whatever, your relationships, how many of you would say that your relationships shape your feelings, thoughts, and behavior? Anybody feel that way? Yeah. So why would you leave relationships out of it? So here's what I'm going to say to you, is that the mind being equated with brain activity, not just influenced by brain activity, but equated with it, has been around for 2,500 years. When you walk in the halls of academia, if you don't go along with that view, you're considered a Luddite. You're considered someone going backwards in time. And so it's a standard view to say mind simply means brain activity. And when I was in training and became a researcher in attachment, it was the beginning of the decade of the brain. And this just seemed to be, as a scientist, yes, the common view, but actually a mistaken view, scientifically wrong and clinically problematic, and societally a serious, serious assault on truth. So, what is the mind? So here's the first little assignment we're going to do. If I say to you that, if you make a triangle, that somehow mind may be fundamentally related to your brain and its body, let's call that the embodied brain, and related to relationships, if mind is one thing, what could that one thing be that would be both in your whole body, including its brain? So we're not putting down the brain. The brain is awesome. Brain science is great. Everything we can learn about the brain is wonderful. We're just saying don't limit it to the brain, as 95% of scientists are doing these days in those fields. We're including the whole body, but then we're including what happens in the betweenness. So what would be the process shared by the within and the between?